Facelift surgery. What is it? When I use the term facelift with people, I get a very wide range of reactions. Some people come into my office and they instantly start lifting up on the side of their face or trying to pull back on their neck. Other people, I mention the term facelift and they get very afraid because some people, when they hear that term, they think of certain celebrities that have a very unnatural look. Those are really extreme cases and they are not representative of how the surgery works and what the expected result can be. Typically, if a facelift is done well, me as a plastic surgeon, if I was sitting next to a patient who had a facelift, I should not be able to tell that they had anything done. The whole goal is to have a very natural result. That's really what we strive for with this operation. There's different types of facelift surgeries out there. The traditional one involves a hidden incision in the hairline here, around the ear, and then the back of the hair. There's something called a mini facelift, and that really avoids a couple inches of scalp incisions. There's also a facelift done with a neck lift, and so that's where there's also an incision done here. This is not a one-size-fits-all operation. We pick which one of those procedures we're going to do based on the patient's needs and their expectations. The times that I would do a mini facelift would be when someone just has a very small amount of what we call jowling, so that's hanging skin down off the inferior border of the mandible here. This would also be done in someone who has a really good quality skin and muscles in their neck. So we would do this mini facelift just to give a little bit of a lift and just to give a nice contour to the jawline. If we need to correct more skin excess or people have heavier wrinkles on the lower part of their face, or we need to do anything with a neck, it's a full facelift. Sometimes we can do a full facelift and not make that neck incision if someone mainly just has some extra skin and maybe they have a little bit of banding of their muscles. But if someone has a large amount of extra fat in this area, or if they have excess muscle bulk or excess glands, we have to make that incision there. Typically, a facelift will last between 3 to 5 hours depending on the extent of surgery. This is done with a general anesthetic or it's done with local anesthetic plus deep IV sedation. When patients wake up or when they come out of anesthetic, they'll have stitches all down the incision length. Those stitches come out in a week. They'll also have a drain in the back of their scalp. That comes out the next morning most often. Whenever I do this operation, patients will stay the night, and that will be done at the surgery center or at the hospital, and before they leave, the drains will come out. What does a facelift recovery process look like? Recovery is not bad. This is not an operation that should be particularly painful. I always call people the day after to check in. Most people are surprised that it's not more uncomfortable. You're usually on prescription painkillers for a day. Even by a week and a half after surgery, most people are comfortable going out and about in public and being seen. They might have a bit of bruising and a little bit of swelling, but that can be easily concealed with makeup. If you're interested in learning more about facelift surgery, please contact our website or phone us at 613-595-1880.